on the modeling side. While most of the work that is done at NCAR is on the modeling side, NCAR has also been supporting wildfire research done by social scientists through a new program called the Early Career Faculty Innovator Program. And this program is sponsored by the National Science Foundation. I'm the coordinator for this program. And so I'm just going to briefly touch about some of the wildfire studies we support. As a coordinator for these projects, I largely just make sure that they have the resources they need to perform the work that they've planned to do. The Innovator Program, it started in 2019. Again, it's sponsored by the National Science Foundation. This program funds university researchers to work with NCAR scientists and co-develop interdisciplinary research projects. It has 2-year cycles, and so every 2 years we select a new group of social science faculty to be involved in this program. They go through the program as a cohort, and they get about $400,000 in funding over the course of 2 years. So the current program just started. This is the 2021 to 2023 program, started September 1st. And if you'd like to learn more about this program, I've left the email up here on the slides, and I can send you that email in a chat too. So because at NCAR there's all this wildfire data and capabilities, the Innovator Program is currently supporting two projects that is working with NCAR collaborators to look at societally relevant impacts of wildfires. And as I said, I think some of the NCAR collaborators are on this call, and I will underscore their names in a minute for each of these projects. The first project I want to highlight is led by Dr. Kat Edgley. She's one of our Innovator awardees for this current cycle, and she's an assistant professor in the School of Forestry at Northern Arizona University. She's a natural resource sociologist, and she conducts wildfire social science research with a focus on better understanding how communities are adapting to the risks and impacts of fire across diverse social ecological contexts. Her study is called Improving Social Adaptation to Wildfire Through Informed Decision-Making: What Role for Atmospheric Models? And her NCAR collaborators are Gabby Feister, Branko Kosovic, and Rajesh Kumar. For this project, the overarching goals of the study, it's just getting underway. Again, it just started in September, but the overarching goals are to better understand how residents in fire-prone areas interpret weather and wildfire behavior to inform protective action during decision-making. And she's also working with NCAR to better characterize the ways in which atmospheric models can best inform public education to improve social adaptation for wildfires in a changing climate. So this project has close connections to the health community, but is definitely is based in societally relevant research, working with communities, working with stakeholders in fire-prone communities. The first part of this work, kind of better understanding how residents in fire-prone areas interpret wildfire data, is going to use NCAR capabilities in a couple of ways. One, to create maps to show how wildfire has spread in a given community. And this is probably going to be from past wildfires. And another way is to map the levels of fire-related air pollution in a given community for a given wildfire events. So if you'd like to learn more, I've put her email in this slide as well as the Innovator's email. And then sorry, I'm losing my voice. We've been fighting one respiratory cold after another. And the second project I'd like to highlight is led by Dr. Michael Mendez. He's an assistant professor of environmental policy and planning at the University of California, Irvine. His project are undocumented Latino and Indigenous migrants worthy disaster victims. And his research collaborators are Rebecca Bullschultz and Rebecca Hornbrook, and they are both from the ACOM laboratory. And this study will conduct comparative ethnographic fieldwork among undocumented Indigenous and Latino migrants in Sonoma County, California. These study participants would have been working and living in California over multiple wildfire events. And he will partner with NCAR to determine the physical hazards faced by these groups and in particular farm workers, to develop culturally appropriate disaster preparedness materials. Another hopeful outcome of this study is to sort of expose or shine a light on the systemic racism that's plaguing these communities. For example, in 2020, that fire season, the Sonoma County Department of Agriculture issued 300 permits to allow migrant farm workers to continue working under mandatory wildfire evacuation conditions. And this is presumably to harvest as much. Beth, I saw your face there. Yeah, this is presumably to harvest as much as possible before the wildfires damage the crops. And anyway, I think that's something that's not widely known or publicized, obviously, and it's a big problem when you have people, when you have the general public being told to evacuate, but then you bring in a bunch of workers to work in those conditions. So this first photo on the slide here is actually a screenshot from a news segment that highlighted his work, where he helped sort of demonstrate the disproportionate impact of wildfires on communities of color. And again, if you'd like to learn more or connect with these groups, please feel free to reach out. They are just getting started on their work, and so it's probably very timely if you're interested in this work as well. And I think with that, I'll pass it over to Forrest. I just want to mention that this is a figure here is from our coupled atmosphere wildland fire behavior modeling work at NCAR, and this might be one of the capabilities that is utilized in one of the studies. So thank you.
Thank you, Cassie, and thank you, Jim and Beth, for having this panel discussion. So I'm going to talk to you, first off, I'm Forrest Lacey, and my research really focuses on developing better exposure relevant predictions of trace pollutants in the atmosphere, anything from aerosols to gaseous species, but also I focus a lot on source attribution. And I think that's where the wildfire systems come in, is identifying what level of pollution is due to wildfires versus anthropogenic sources. But I'm going to talk to you more about NCAR's capability and the tools that we use for wildfire modeling and observation. And the first one, as Cassie mentioned, is the COFPS fire prediction system, which uses warfire as a predictive framework for modeling wildland fire behavior or spread of wildfires and anything related to that. And Branko Kosovic, who's on the call, is kind of the head developer for this. So if we have any questions, I may defer to him on that. Oh, go ahead. But one of the tools that we do have is the chemical forecasting that we do using WRF-Chem. And what you're seeing here is the first and second week of September, where we had significant wildfire infiltration from the California fires. This is showing the output from those runs. So on the left, you have the CO fire tracer, which is carbon monoxide from fires. And then on the left, you have anthropogenic, and you can see that you have this huge signal basically spreading. And then as a storm front comes in, pushes it down into Colorado. And this is what we experienced in September, early September, as I'm sure a lot of you are familiar with. You can go to the next slide. In addition to the modeling frameworks that we use, WRF-Chem and other models that I'll talk about next, we also do have observational and data assimilation capabilities. The first one that I want to mention is the fire inventory from NCAR, or FIN. This is a highly resolved data set that is produced near real time for global biomass burning emissions. And this is based on satellite observations of fire kind of events. And then we calculate based on land cover and things like that. The model itself calculates the emissions, and those can go into a number of different modeling frameworks. Oh, and then the other one that we have, oh, if you could go back, there we go, is the MOPIT tool, which is the satellite instrument on Terra, and that observes atmospheric CO. And this is particularly relevant for wildfires because, as you can see here, we have an observation of kind of, this one is from, I forget what fire this was. Oh, this was from the Creek Fire last year in 2020 October. But you can see an elevated CO signature here, and that's something that we observe with the Moppet instrument. We also have observations of air quality for fire-specific field campaigns, and the two that I just want to highlight are both WeCan and FireAQ. You can find all the data for that at the websites listed below. Next slide. And I mentioned that we use multiple models. We use anything from regional models like WRF-Chem to global models like CESM, but we also do box models or LES models for things like plume rise or really comprehensive chemical speciation. And the framework that NCAR is moving towards is a framework called MUSICA, which is a multi-scale infrastructure for chemistry and aerosols. We're trying to combine these models into a common infrastructure, and I'll show why this is important for wildland fire modeling. Next slide. So these are initial MUSICA results. This is for the Rim Fire in 2013, which at the time was one of the largest fires in California. And in the first panel, you have the regional refined model. In the second panel, you have the coarse model and then the difference. And what you can see is that we're predicting a kind of wildfires over a spreaded area in the coarse model, which really impacts how populations are affected in exposure. So this is really important for dealing with wildfires, that we have these resolutions at exposure relevant scales. You can go to the next slide. And then the last thing that I want to talk about is current projects for applied wildfire research at NCAR. Hopefully these are interesting to you. Both of them are just kind of starting within the last 2 months. But the first one is where we have a interagency agreement in collaboration with the CDC Climate and Health Program, where we're developing wildfire specific exposure response functions using high resolution reanalysis modeling for the Western United States. So this is, we're basically taking a 16-year period, calculating exposure to both particulate and gaseous species from wildfires, and using hospitalization data to develop these exposure response functions with a focus on wildfire specific exposure. And this is a project that I'm heading up in collaboration with Rajesh Kumar, Senlin He, and Cassie as well. And then the second project is actually an augmentation on an existing NASA project that Rajesh Kumar and Gabby Pfister are PIs on. But what we're doing with this project is we have a long-term high-resolution chemical reanalysis based on NASA observations. And the augmentation of this project is to create a dashboard for public use or stakeholder use, which will allow users to explore historical air quality data, including wildfire exposure. So this is another one that I'm pretty excited about. I think that this will have a lot of public-facing elements that I think would be important to the wildfire community. And I think that concludes the slides that we have.
Great, thank you so much, Forrest and Cassie. Appreciate that. I think now we will move on to our colleagues at Colorado State University. And I think Dr. Cheryl Magsamen is going to be speaking on behalf of the group there. So Dr. Cheryl Magsamen is Associate Professor in the Department of Environmental and Radiological Health Sciences at CSU. And she can tell us more about the wildfire research that group is doing.
Thanks, Jim. Good morning, everyone. Are my slides showing?
You see your face.
Not yet. Yeah, just your face.
I'm getting a little exclamation point when I try to show my slides.
Do you want me to do the same ones you sent us this morning, Cheryl?
No, I made some adjustments. I just got my OS upgraded, so I might have some sharing problems. Good times.
Do you want to email them? Wait,
Actually, Jim, would I be able to can Colleen sub in and I'll email these to you, Jeff?
Okay. Colleen, are you ready to go?
Yeah, I can go. So let me just pull up. I don't have beautiful slides to present, but I'll get started and talk through. I just thought that, I don't know, I just feel like it'd be nice to just talk. So I am an assistant professor in the geography department at the University of Colorado Boulder. And I have done a lot of work over the years on wildfire, smoke, and health, but in general, I'm looking at environmental exposures and how they influence health generally. And in the past few years, I haven't had sort of a funded project looking at wildfire, smoke, and health until about a month ago, and I'll get to talk about that and what we're getting started there. But what I have done is I feel like I've been pulled into a bunch of things that I might just talk to you a little bit about, which is more just, I don't know what the right term is, sort of commentaries or review papers on different wildfire, smoke, and health work. So, and a bunch of these things are coming out soon. So just to let you know so that you can take a look at them. So pretty soon there is a book coming out, a bunch that has a lot of different chapters related to wildfire smoke that's coordinated through the US Forest Service. And I think they've done this before, but this time they added in a chapter that focuses on the health effects of smoke. And so Sarah McCaffrey is the lead author on that chapter, but there's a lot of great people who do a lot of work on health effects of smoke in there, including people through NIOSH focusing on the occupational impacts, and people at EPA like Anna Rappold and Jason Sachs. And then I got pulled in to help out on that. So that we just got the proofs, so that that book should be out soon. I think that should be just an update on what we've had of the health impacts of wildfire smoke for those on the call who maybe are not as aware. And then I had a paper that I collaborated with some folks from the Forest Service with Michelle Kondo and a group of her team that just got published last week in Science of the Total Environment. And what that one was doing was we were looking at sociodemographic and health vulnerability in areas that were exposed to prescribed burns within national forest lands compared to lands not exposed to prescribed burns over a period of time. And so that I'm happy to share the link for that with anyone who's interested. And then we're going to try and follow up on that with some more work. And then one other thing, just that given that the COP meetings are coming up soon, I was just pulled into something. Many might know more about this than I had before getting pulled into it. So there's this group that'll pull in these 10 new insights on climate science across, and they pull in researchers across the globe. And so we just submitted it for publication. The goal is to get it published and out to policymakers right before the COP meetings. And they choose different topics every year. And one of them this year was on climate change and fire. And they had a bunch of researchers who focus on just fire ecology. And I got pulled in to just write the small health part of it. And so hopefully that'll be published soon. And that was kind of an interesting and new project. And I think it was interesting to this group in regards to the fact that they hadn't thought about health much before in this small group. They have Chris Ebi on it, which is great. And I think she's pushing the health focus the past few years and getting more of that in there. So then what's exciting, what I wanted to spend more time talking about, and I'm happy to answer questions if there's time, is I'm very excited that finally, after lots of attempts to get funding for more work on wildfires and health and failure for many years, it seems like, and trying to collaborate with some others in this group. I got an EPA funded grant. I'm one of the people funded through the early career mechanism. And this project will be looking at PM 2.5 levels during wildfire events and compared to non-wildfire time periods inside and outside schools and homes. And we'll be focusing starting off with the Denver Public Schools, but if we need to enroll, if we can't get enough enrolled schools just in Denver, we might expand to some school districts in, the Denver metro area. And then also getting some health outcomes from the students and trying to help inform the question of whether or not schools should stay open when air pollution is really bad from wildfires. The current guidance says that the decision should be made by school districts or schools based on whether the air pollution is better in schools or homes, but we know no one has that data. And then also I think, I think it'll be really interesting coming off of what we've learned from COVID about the harms to kids of keeping them home if unnecessary. And also the fact that there's been this huge push to improve the indoor air quality within schools for COVID. And therefore I actually very much expect that in most schools, the air pollution levels will be not so bad during these wildfire events, but it'll be interesting to collect that data. So we'll be using low-cost sensors. We'll be teaming up with the Love My Air program in Denver. They've already put outside sensors at a bunch of schools and doing that comparison and then trying to recruit homes that are for kids at some of those schools so that we can do some comparisons, trying to get representation of the diversity of sort of not just populations, but also schools in terms of like older schools and newer schools and schools with different types of HVAC systems and all sorts of things to try and really get, and similarly with homes, like trying to get homes that represent the type of homes that we have in the area, just to get a sense of that. And we're gonna focus on the elementary schools. And one of the reasons we're focusing on elementary schools is because there's data that's collected by the school nurses that we can use to try and see if there are health impacts associated with the air pollution levels. So the school nurses in elementary schools in Denver, in the Denver public schools, and I believe in other districts nearby, but we'll have to look into that. Students in elementary school are not allowed to carry an inhaler if they have asthma, and they have to go to the nurse if they need it. And the nurses have to document when students do that. So we can look at that data versus middle school and high school students can carry their own medication. So we'll be looking at that, and then we'll also get students to be reporting symptoms. And I don't have pretty graphics to show you yet because we just started this past month and I'm in the midst of IRB and compliance documents for EPA and trying to hire a postdoc who can help make this a reality. And that's what, that's what I'll be working on, and I'm really excited about that work going forward. And I guess I'll stop there.
Thank you so much, Colleen. And I'm sorry I didn't get a chance to give you a full introduction, but we all know you're amazing. Congratulations on the EPA grant. That's really great news.
Really excited. Yeah, I feel like there's a bunch of us who have been trying for a while, and I'm glad that other folks have things going, but hopefully we can also make more connections in this group to have more collaborative research across teams going forward.
Indeed, and that Love My Air program is so great. I love it so much. All right, so now I guess we will move back to CSU. Hopefully the slides are now working. Yes, they are. Excellent. Have at it.
Thanks, Jim. All right, we're going to tag team this. So I'm going to give a brief overview. Hi, everyone. I'm Cheryl, in case I haven't met you. We're going to give a brief overview of our wildfire smoke research. Next slide, please, Jeff. And this is definitely a group collaborative event. I somehow picked the straw to present today, so I thanks my collaborators. Instead of putting pictures of us up, I wanted to put pictures of our purple air monitors up. So we kind of joke around that we like to find out what's going on or at each other's houses, and we go on purple air and see what the air quality is. So part of this team is the excellent Emily Fisher, an atmospheric scientist at CSU, whose expertise is on smoke and ozone precursors, smoke nitrogen budget, and she is incredibly well known for her aircraft monitoring campaigns, including WECAM. Jeff Pierce, another excellent atmospheric scientist at CSU, whose expertise is smoke aerosol chemistry, microphysics, and smoke climate interactions. And I am in environmental and radiological health sciences at CSU. I'm a respiratory epidemiologist, and in my spare time, I dabble in field-based exposure assessment. And the three of us have been working collectively since 2014 to work on wildfire smoke and health. Next slide, please. So this is a lovely slide from Emily that kind of talks about building our research community that really started off in 2014 when we received a NASA funding from the ROSES program to look at wildfire smoke and health. And that included development of surface values for smoke in various states around the country, health effects, and this kind of has morphed into this very large and very collaborative research program that includes atmospheric science, engineering, epidemiology, biostatistics, economics, and communication. And Marilee Long, under the at the end of the slide, is one of our fantastic communication scholars at CSU, and we are moving into understanding, now that we have health data as well as air quality data, how do we communicate, what do we do with that data, and how do we keep the public safe? So it's been an amazing community of people to work with, and I think one of our goals especially as researchers, is really to foster this next generation of both health scholars as well as atmospheric science scholars. Next slide, please. So collaboratively, we have a lot of work that we've been doing, which has been great, but I wanted to talk about a new project that we just got funded, which was what we can learn from the health effects of agricultural fires, and presenting case studies, or talking about case studies in Kansas and Florida for this upcoming year. So funding for this project came from the NASA Health and Air Quality Applied Sciences team. So Jeff's the PI of one of our studies, which I know a lot of you wrote letters of support, and we thank you for creating fused Earth observations for health research and also social science research. And from that initial HACAST funding came the opportunity to put together a HACAST Tiger team. And we are putting together this Tiger team. We got funded, I think, in July, to look at, again, this topic of agricultural fires. So I'll talk about that briefly on the next slide. So agricultural fires are really, really interesting. The tallgrass prairies in the United States burn, mostly from prescribed or purposeful burns. And this was to control woody growth and invasive species and promote grass growth for cattle grazing. And this is kind of in Kansas and Oklahoma. And then croplands in the United States also burns with the effort to remove crop residue, and also with some use for pest control, which obviates the need for chemical pesticides. So one of the things that has happened over the last 20 to 30 years are these changes in agricultural burn practices around the country. It's still used widely abroad, and actually most of the research on health effects from agricultural fires have been international in focus. But in California, rice farmers used to burn crops also, but that practice ended due to air quality concerns. And in the Willamette Valley in Oregon, grass seed farmers actually burned the land also. However, in 1988, there was a fatal car accident due to lack of visibility on Interstate 5. So that practice of agricultural burning on the West Coast has really, really been massively reduced. However, there are some considerations, especially again for this tallgrass prairie region of the United States, as well as other agricultural regions, specifically in the Southeast. One of our major concerns in terms of agricultural fires are health disparities. Because these are agricultural regions, there tends to be less ground-based monitoring from federal regulatory monitors, so it's unclear what those air quality levels are in areas that are not as well monitored. And again, because these agricultural burns happen seasonally, this potentially presents an opportunity to understand the chronic effects of biomass burning, as opposed to these sporadic, although very large, biomass fires that we get here in the Mountain West and the West Coast. Next slide, please. So through a very long, complicated relationship with some reporters from ProPublica, I was approached by Lulu Ramadan, who's a ProPublica fellow and an investigative reporter at the Palm Beach Post, who is very interested in our group's wildfire smoke and health efforts. She put together this really lovely article that was in the Palm Beach Post in July, trying to understand the impact of sugarcane burning in the southeast and central regions of Florida, which definitely impact communities of color regularly, as South Florida has one of the largest sugarcane areas, planting areas in the United States, and communities around the area get impacted by PM 2.5 from the burns seasonally. And again, this is in Palm Beach County, which stretches all the way from Central Florida to the coast, and most of the air quality monitors are on the coast, and not having a strong idea of what the PM 2.5 levels are inland, where again, the burning occurs. So Lulu and her team at ProPublica did this amazing job putting out several purple air monitors and looking to understand what the impacts of air quality on the community is, specifically for Florida. Yes, go to the next slide, Jeff, thanks. So previously, I was at University of Oklahoma before I came to CSU, and I had been contacted several times by the Sierra Club at Kansas, who is also concerned about the levels of PM 2.5 from the agricultural burns occurring in their area. So working with these two study domains, our team is going to focus on creating data fusion products to assess PM 2.5 exposures in these two agricultural areas that have limited federal monitoring. So that is a combination of using data from NASA MODIS, NOAA VIIRS, the purple air monitors, which we will supply to the communities, as well as using ground-based EPA IQS monitors. So what we're doing as part of this study is also implementing an epidemiologic study in Florida using a previously developed model by folks at Florida State to estimate health impacts. And the long-term goal is not only to understand what these these satellite and Earth observations of small fires and smoke resulting from small fires look like, but to understand long-term exposure to biomass burning in these communities, which again, helps us a little bit because it's really complicated to do that when we have these, again, massive burns from the forest here in the Mountain West. So that's, I think, all I have for today. And again, happy to take any questions. And Jim and Beth, thanks again for the opportunity to present.
Well, thank you so much, Cheryl. That's some great stuff. I'm so happy that the team at CSU got the Tiger team. Their project was accepted for a Tiger team. That's fantastic. So now we're gonna pivot and spend the rest of the hour with discussion and Q&A. And so I'm gonna tee it up with a question, but if you have questions for the folks that we've heard from, please write them in the Q&A. And if there are follow-up answers or questions from other panelists, you're sort of welcome to chime in. But the first question is, what are the big open questions in wildfire smoke health research these days? Colleen, I know you've been thinking about this. So.
Well, I think that just to start thinking about it, I think Cheryl's group looking at long-term impacts is something I'm asked about all of the time, and we don't have enough information on. So I think it'll be great, like all these people will ask news reporters, individuals in the community, what's the long-term impact of these really high air pollution events, and even just starting to get at it with agricultural burning, which we know, is more regular, but possibly not at high exposures. But that's another great thing that you'll get some data out there. I think one of the things that we don't really know, and I think also people are really interested in that in terms of their children and the impacts of the developing of really high air pollution exposures. I get that question a lot from parents. That's one thing I can think of as an open question. And I think another thing that Cheryl touched on that is the lack of monitoring in a lot of places, and the desire to improve, like Forrest was talking about, improve our understanding of air pollution exposures at health relevant scales, which I'd love to have him talk about a little more. There's a little chat over here, but either through models or satellite data or more monitoring or combining those all together. And so, so that we can have a better sense of what the actual concentrations are in places where we have very little regulatory monitoring. Those are a couple of things that come to mind, but there's more, I'm sure. I just haven't thought of, that's what is top of mind right now.
Cheryl or Jeff or Emily, do you have thoughts?
So one of the things the three of us have been thinking about a lot is smoke from fires that are nearby versus smoke from fires that are a long ways away. And the smoke, of course, changes chemically, both in the gas and particle phases. but people's awareness also changes. So anecdotally, my parents live in the Northeast, and they were getting hit with 50 micrograms per meter cubed of smoke PM 2.5 this summer, and they thought it was fog, because you can't smell it. You can't smell smoke when it's more than a day old. So there's all of these different factors in terms of people's perceptions, changes of behaviors, as well as the like true explicit health impacts of breathing that smoke that are fascinating and still fairly unknown.
Forrest, I see a hand raised, Forrest.
Yeah, so I kind of want to just echo both what Colleen, kind of combine what Colleen, Cheryl, and Jeff all said. Is kind of one of the unanswered questions from my perspective is both the kind of the temporal exposure response. So what is it what metric should we be looking at with wildfire smoke that is tied to a health impact? I think that's really important to identify that. Are we worried about chronic impacts, which is impacting long-term exposure, or is it these acute spikes? Which one of those are most tied to a specific health outcome, or is that something that we can evaluate? And that's some of the data that we're really trying to get with the CDC collaboration that we have. And then also linked to what Jeff was talking about was the speciation of wildfire smoke that also touches on agricultural versus wildland fires. Is the speciation important? Aging has a big role in that. I think that we really need to develop that kind of understanding as well.
And I think I will answer my own question briefly, because those of us at Respiratory Hospital get asked about exercise and wildfire smoke like all the time. And we just don't know a whole lot. I think there's conflicting advice from different aspects of the medical community, where the respiratory docs are saying, please stay inside, and the cardiovascular docs are saying, please exercise. And it's hard to do both sometimes. So I feel like there's more that needs to be done in that area too. Cheryl, you have your hand raised.
I do that. That took me like 5 minutes to figure out how to get my hand raised on this version of Zoom. So one of the things I wanted to add also is not only looking at long-term impacts, but looking at chronic repeated exposures also, where wildfires are now moving out of what we traditionally thought of as disaster epi, and now into more kind of repeated exposures that, again, people across the country are getting every summer. I also know that, Jim, the last time we met, actually, which was great at CSU, maybe you met between there and I didn't participate, so I apologize, but we talked about using animals as sentinels for wildfire smoke too. So we have our cow project is hopefully going to be, we just had our revision submitted, which is trying to understand, I think Forrest brought this up, and Jeff, when you don't have the ability to shelter in place, or this idea where you can actually modify your behavior, which production animals don't, what the subclinical impacts of wildfire could be, and what that looks like compared to PM 2.5 also. So there's I think a real brain trust here trying to figure out how to get around this issue when we don't have these kind of predictable spatial and temporal patterns of PM exposure, and what alternatives do we have in our EPI study designs to address that?
Thank you all. We had a question aimed at Cheryl about CKD in Florida. Let's see, scrolling back up here. Are there higher numbers of CKD patients in this region of Florida, I guess South Florida?
Yeah, I'm still trying to, I was trying to put down my hand. Yes, because I know that what's really interesting is that I know Lee Newman, John Agate, Kathy, Josh Schaefer, and Allison, and I think someone else at Anschutz, so I'm forgetting his name, and I apologize. Maybe Rick Johnson, are looking at health effects of sugarcane workers in Guatemala, and kind of the effects of burning both on the workers themselves, and I think Jamie's working on this as well as people who live in household. And it's really interesting, because I think with the soil potential, the uptake from sugarcane from what's in the soil, there may be massive differences, because I think, Allison, if I'm correct, there's volcanic residue in Guatemala, where in Florida that is not really part of the soil biome as much. So there could be some real interesting differences in terms of kidney effects that I know that the EOH group in Anschutz is seeing in Guatemala as differences that we potentially see in Florida. So at this point, we don't have a prospective study in Florida, but we're hoping to get there someday.
Great, thank you so much. I'll ask another question. If there are projects that you would love to do, but you haven't found the right partner to do it with, or person with the right expertise, what expertise would you like to partner with? And maybe there is somebody on this call who has that expertise.
I guess I'll start because this gets back to Jonathan Patz's question on exposure. Is I think that quantifying exposure is a really large challenge in this space, especially as people modify their behavior once they're in a wildfire environment. Jeff also talked about his parents in the Northeast and how they didn't have any response really because they weren't aware that it was wildfire smoke. So, and this kind of ties back into if you're trying to develop a health impact, if you're just using concentration for ambient concentrations, it's not necessarily representative of a person's exposure, and different populations or different groups may react differently to wildfire exposure. So I think a better job quantifying what a person's behavior is, and this might tie into some of the social science stuff that Cassie's working with the Innovator program. But I think that that's one realm of kind of me coming from an ambient air quality perspective. It would be really nice to work with somebody that has a better understanding of how that translates to kind of human reception and exposure.
Colleen, you have any thoughts on this?
I'm sure that there have been times, I feel like right now, I'm not feeling like I have that idea in my head at the moment. I think sorry, can't say anything right
now. Okay. I was just wondering, there's so far nobody has really mentioned like working with bench scientists, like biologists and things like that, looking at sort of animal models of smoke exposure or things like that. So wondering if anyone has thoughts about where that could be pulled in.
Maybe,
oh, Allison, yeah, go ahead.
I was going to say maybe I should chime in here. So the challenge with doing anything in animals, obviously, is that to do a true smoke exposure, it's better to do it by inhalation. And I'm not sure we really have that kind of capability. We can do things in vitro, certainly. And I know that Jared Brown's working with, I think John Fulkins and some people up at CSU right now with some extract, but and we're all interested in doing that. But as far as true animal models with the appropriate route of exposure, it's challenging. So, but certainly I think we're interested in doing that. So I'll throw my name in the hat, and Jared, I'm going to throw Jared's name in the hat too.
Great, thank you, Allison. Well, do any of the panelists have questions for each other? Cheryl, I see a hand raised.
I'm just going to raise my hand manually. Since Jamie just texted, I was wondering, Jamie, can you talk about the Guatemala study? I think it would be great for people to hear what you're doing, because again, I think it adds a rich dimension to this conversation.
Sure. Yeah, we have two studies starting up, an R01 and a K01. That's mine, funded through NIEHS. And both will be looking at personal air samplers of sugarcane workers. And then the R01, it's of the men workers, and then the K01, it's women workers and also women household exposure. So they'll be wearing personal air samplers while the neighboring fields are going to be burned, because they burn the sugarcane fields before they harvest every day. So they're exposed to heat and then high levels of particulate matter, and then probably metals in the air and pesticides, who knows. So we're going to be measuring all these things in the air and in the urine. So heat plus air plus underlying health conditions. It'll be interesting.
That's such a great project. I'm so glad that I get to be one of your mentors on it. We had a question from Cassie.
Hey, sorry, I may have forgotten my question when I raised my hand. But I'm just kind of curious if anybody here works on compounding disasters. So I think it was something that Jonathan had maybe put in the chat, but looking at the overlapping and compounding impacts of extreme heat and wildfires, or, you know, something similar, maybe even COVID as well. But that's something I think is really interesting, and I'd like to kind of think about more, and also, you know, think about collaborations with anybody here who's interested in that as well.
Well, certainly I'm interested in that very much. So I'm happy to talk to you more about it. But maybe other folks are in that zone as well.
I'm also really interested in that. I mean, I think about this past summer in Colorado, you know, it's similar to what Jim was saying, but you're told different messages for different things, right?
Mhm.
You're told to open your windows to cool off, right? And there's a lot of homes that don't have air conditioning. And then you were told to keep them closed for the air pollution. And just sort of how people, I think there's a lot of, you know, you could do empirical research with data to look at temperature and air pollution, but I think it would also be really interesting to see how people in different contexts navigate that situation, and what health advice they take, and what the health impacts are of different choices.
Mhm. And I think this sort of is what Forrest was saying, that working with social scientists to study behavior and work with individuals, that might help kind of fill in some of those gaps.
Yeah, and the COVID, air quality, heat, everything, mishmash, it's very hard to disentangle, but very important. So, yeah. Maybe last question from Katie.
Yeah, so I was just gonna say I'm also really interested in the sort of policy and intervention side of these questions, and I put in a proposal with Colleen and Christine and Cheryl were advisors, to look at specifically around prescribed burning. So understanding more about people's perceptions of, you know, their exposure, and how that varies, right, depending if you're in a community that is directly exposed to prescribed burns. So if you're in a WUI community, as opposed to if you're, you know, someone who's maybe going to get a small slice of that smoke, but you know, but it has the potential to reduce longer term catastrophic events. So that same kind of question of trade-offs and how different communities are evaluating those risks, and then, you know, how the policy, what the policy process is around these questions. So that's something I'm really interested in. And I thought, yeah, Cassie was really interested to hear about Michael Mendez's work, because I think the equity dimensions of this are also really important and probably understudied.
Well, happy to put you guys in contact.
That'd be great. This is a great session. Thanks, everyone. Good to see you all.
Thank you all, everyone. Before we go, I just want to say thank you to our panelists for a wonderful panel today. So virtual round of applause. And also thank you to Elise Grover, who is the environmental health DRPH student who's been managing the logistics of the call. And please keep in mind, if you are interested in joining or being a part of the air quality working group of this consortium, please get in touch with Cassie. She is in charge of it. If you can't find her email, you're welcome to get in touch with me and I will put you in touch with her. Also, we will be having more of these monthly or semi-monthly events with a similar format, so please keep in touch. Hopefully we'll have one on policy implications featuring Katie one of these days, as well as others. So thank you all, and I hope you have a great month until we get to see you again. Take care.